Hello, everybody, and welcome to a new episode of Equidemia Insights. Insight is the new name of the Equidemia podcast, and we are standing for evidence-based training. My name is Selina Skogan. I'm the founder of Equidemia, and I am your host today. And today we will talk about something that is very close to my heart. We will talk about a functional gait analysis and why I consider this tool so important in our daily work as a trainer and also as a rehabilitation therapist. So I think this is a tool that all of us should be able to handle. And this is why we also have prepared a little free download for you on our webpage with a mini course, gait analysis. I'm discussing with you the topics that I am discussing today also in the podcast. Enjoy. So when we are talking gait analysis, we first have to clarify there is so many different types of gait analysis that this is a discussion on its own. And I would like to take that with you now, because we can have a veterinarian gait analysis. That is what the veterinarian is working with when he's discussing the point or checking the point of the horse being lame or not lame. That is a very important approach, but also a very difficult one. So the vet is checking, is the horse lame or not? And this check is basically standing on the feet of the pulley lever theory. So we are looking at, is there one joint, one or multiple joints less functional than the others? And we are not so much looking into the topic of the overall structure of the horse. That's also the reason why so many horses with gait abnormalities are passing a lameness test or are not positive in a flexion test. But when we are looking from the perspective of a functional gait analysis, or we are having a veterinarian that is explicitly schooled in gait analysis, we'll say, yeah, maybe we don't find it in the limbs, but we find something in the back, or we find something in the hip, or we find something in the neck. So that is the first thing that you need to distinction. Not all gait abnormalities, when I'm later on speaking about gait abnormality, are creating lameness. And the other way around, if I have a horse that is very obviously lame in my eyes, then this is off borders for me. This is not my topic. Then I will send you to a veterinarian. As simple as that. Still, I do believe that all of us trainers do need to know, is the horse gait abnormal? Yes or no. First, for detecting lamenesses and to know when do we need to take our hands off and not train a horse though it is lame, because every pain is creating discomfort and I want my horse to be comfortable when I'm working with it, of course. But also due to the fact to simply understand where is this tool standing in the sometimes very complicated puzzle of gait normality and abnormality. Also, we need to understand that when the veterinarian is making a veterinary gait analysis, we have two different tools, the objective gait analysis and the subjective veterinarian gait analysis. And that is where it's getting complicated. So let's start with the subjective gait analysis. And I'm just noting down that also about AI, we should maybe create an extra episode about that because it's so interesting. But let's start with the subjective veterinary analysis. And here the vet is evaluating what they see. And there is a very interesting piece of paper out, I think it's from 2021, where Müller-Quirin has been making an overview about how good are we detecting with our eye, equine lameness or not lameness. The result is a little bit shattering. I'm not sure if we actually want to know that, because 50% of the horses that they tested were considered from owner, trainer, and vet wrong positive. So the horse was supposed to be lame, but was not positive in the flexion tests. And horses that were very obviously lame or having a subtle lameness were negative were considered negative from vet and owner and trainer. So basically, you can throw a coin, and that is as reliable as this kind of examination. Hence, we need a little bit, we need better tools. Luckily, also smart veterinarians are aware of this problem, and a part of this problem is that they don't learn gait analysis during their time at university. It's an own field, and either you are interested in this field or not. I am very interested in this field, hence I took a 2-year education for being able to see that. Simple, right? But in this connection, so you really need someone who's interested in that field, and maybe the veterinarian that is coming to your place for vaccinating the pony is not the right person to ask. Then you need to go and ask a specialist if we obviously see that something is wrong. Because if a vet is interested in that, he will maybe do an internship at a vet hospital that is specialized on that. Or they will do the big IGAS education that is only doing gait analysis also over a year. Or, they will find another way of, they do in German, we call it Facharzt. They will find another way to specialize in this field. And then they are getting really, really good. But we can't be good at everything. And I mean, I'm also not going to my eye doctor if my foot is hurting. And I think we should start to see veterinarians as that they are specialists in a field, and you need somebody who's good with the general overview, and then you need a certain amount of specialities, and then you don't go to anyone who is good with colics for diagnosing which limb is lame. Actually, it's pretty logical when we are thinking about that, right? You can't be, you simply, I mean, how long do you want to study? You can't be good at everything. I will link you also the study about that I've been talking here, of course, in our newsletter, because that is one of our gold nuggets for today. So, in the subjective veterinarian analysis, then after detecting which lame is good and which is not good, the vet is usually bending or flexing all 4 legs and then seeing Hicks, starting with the best one, so where you're expecting to have least result, and then going through. And that is very important. I can tell you a little story, because when I'm thinking about my own little cold blood trotter, and then I had several vets here, and they were all looking at the horse and said, it's nothing. Yeah, it's nothing. And when we started flexing him, and also when we were working with more diagnostic tools like nerve blocks, anesthesia, X-ray, and so on, we found out, no, it's not nothing. He simply is lame on all 4 legs, and it's all joints that are hurting for him. So he is so unlucky that he has a rare, or in cold blood trotters, actually, as I know now, a very common disease, which is an infection in the synnova. So the synnova is inflamed and dissolving over time. So these horses are basically experiencing pain all their life, and then eventually it is getting worse, so they will never be trainable. And I think this is an important information that I would like to know. Yeah, because I don't want to train my horse into pain. But then, of course, and that's the important message, if the horse has multiple lamenesses, it's much more complicated to diagnose and to see, as if we can very clearly see one leg is affected. And that is also the downside of the next type of gait analysis, and that is the so-called objective gait analysis. So what is objective gait analysis? It's simple. Everything that is including sensors, pressure plates, cameras, AI apps, that is all called objective because they measure data, and data usually doesn't have a confirmation bias, but the one of the person who has been programming. And that is a great step forward, because we can eliminate this 50% rate. But it's not perfect yet, because cases like Myvilia, for example, are simply not found. That is something that the AI can't do. The AI is measuring stance faces, but and pushes, and also the evenness of steps. But if we have multiple lame legs, the AI doesn't catch it yet. We have been trying that with multiple horses. We have also been feeding the AI with horses that were showing neck abnormality or back abnormality. The AI considered them perfectly normal. So I think it's a great tool to support us, but not the tool. Not the tool that is protecting us from needing more education, basically. So AI can be a good support, but it can't replace our training, our feeling also, because it will be you who is catching your horse first when you see the horse is showing pain signals also that AI can't detect yet. The very smart people are working on AI that is starting to detect pain phases, and I like it. But there is also there we see that the more subtle nuances is not caught yet from AI, but that if you're getting trained for half an hour in detecting pain phases, your detection rate is going up to 89%. And that's not nothing. I think that's quite good. Of course, we are dreaming about 100%, but usually you will not only look at the face, you will look at the overall posture, and you will look at the behavior, and so on and so on. So 89 on a picture is pretty, I think that's good. That's good. That's hopeful. And the same is true for gait analysis. So the tool I am working with, my main tool, that is a functional gait analysis. And here I am not looking at lame or not lame. I am looking at how does the body function in motion. And this type of gait analysis is based on physiology and on movement science. So that means we are not looking for perfection. We are looking for functionality. And that is a very important difference. Of course, if I am seeing as a non-veterinarian, I'm not allowed to speak about lameness, but if I'm seeing something that is hinting towards lameness or a very abnormal movement, I would say this is off limits for me. I need to send you to your guiding veterinarian. But beyond this lame or not lame, subtle lame or not lame, we can see much more. So hence I am dividing the horse into movement units, what also research is doing when they are looking at functionality and when they are trying to understand how is tensegrity working, how is mechanics in the body working, and how are these two functioning as a nonlinear system together. And I think this is so important, because with that, we can't only see the horse is sick or not sick, the horse has pain or not pain, but we can also say nobody is perfect. And what do we do with all the imperfect bodies? So maybe we have a percentage or 2% or something of bodies that is perfect. But do you really need to have a perfect body, or do you really need to have a perfect horse? My body isn't perfect, but I have a quite good life quality. Also, because I know what kind of sport, what kind of movement is good for me and what kind of movement is not good for me. So if I would start to do now, I don't know, marathon, for example, it's a little bit off limits for my knees, especially for my right knee. But if I'm doing yoga, yeah, great job, continue doing it. If I'm doing a little bit of weightlifting, great job, continue doing it. If I'm trying to go to the Olympics, not so good. And here we are coming into the area where we can say, okay, we can separate movement into normal, not normal, but not abnormal. I'm calling it tolerable, and completely abnormal, meaning red flags are going up. That is also what you're learning in our masterclass, that we are looking at this perspective because we need it when we are training horses up. Also horses that are having pathology. So what is the area in that we can still train, and what is the area where this is getting really, really difficult and we are taking money down the bank account? And that is often how I like to look at this topic. If we're imagining we are having a bank account with, I don't know, let's say $1,000 or €1,000 or whatever is on there, and at least the bank account is full at the start of the horse's life, and then I continue, and then I start training, and because I don't know better, or because I'm following the idea of a riding philosophy. And then depending on what riding philosophy I am following, my perfect movement will look different. It's very different if I'm doing cowboy dressage or if I do Californian Western style or if I do academic art of riding or if I do classical dressage or if I do FAE. And all of them are very sure they're right. And none of them understands physiology. So what we are doing here is understanding physiology, and then it doesn't matter anymore what riding style you want to perform. Yeah. So we always look at how physiological normal is this movement and how can we adapt your training plan, your nutrition, your whatever to this body and to the goals that you are having. And that is also why I think that all trainers should understand physiology, a little bit of physiology, and a little bit of gait abnormality. It would be so important. So I am, because I want to fill up this bank account. I don't want to, from the start of the horse's life, continuously take money off the bank account, because when it's empty, then we are starting to create pathology. And also, if we are horses that have pathology already or that are a little bit imperfect, it doesn't mean we can't do anything with these horses anymore. Maybe we need to adapt our goals, but most likely we will find out how can we spend time well together and live with this imperfection. And I think that's it's a very, very important perspective, because there's not so many of us who need to use their horses for heavy work, but all of us love our horses and would like to have fun, have joy of movement, create good moments. And when I'm looking at from the perspective of functional gait analysis, I am looking at the 5 movement units that we have in the horse: head and neck, spine, thorax, forehand, and hindquarters. And of course, a completely different system that is just part mechanically, but yeah, very, very important. I am looking at the recoil system. So the elastic spring, is it easy? Is it difficult? Is it easy? Or is it the same on all legs? Can I create this feathering push effect in the pony? Or is something wrong here in the tendons, in the passive stay apparatus, in the ligaments? How is that going? Also, what we need to understand is, when we are looking at that, is that there is a perspective, not only the mechanical perspective, but also the perspective of neurophysiology. So what goes on in the equine nervous system and in the mind of the horse? Do we have a damage here? And then I'm not talking about stress. I'm talking of spine injuries. I'm talking of injuries of the peripheral nervous system. I am talking about nerves that are atrophying because they are not supported by the system, and so on and so on. So you see, I am not judging the horse. I am trying to identify load limits, load capacity, and I am trying to adapt training intelligently. That's very different to a pure riding instructor perspective, because as an instructor, we very often think, how do I make the horse do what I want? How do I optimize the movement? How do I make it look better? And the risk is we are interpreting movement through our training physiology and miss functional limits. And I'm experiencing that often, that we see a horse that has a dysfunction, for example, in the hindquarter, but instead of looking at this dysfunction and either loading the horse accordingly, we are trying to train that away. Or having a dysfunction and isolating it and saying, okay, we need a vet check here. We need to see, can it be loaded at all? We are trying to train that away. And then something that is acute is quickly getting chronic. And that's just so unnecessary. If we would look at that from the start with a little bit kinder eyes, and not with the idea of we have an imperfect, not human, but equine being, and how can I fix that? How can I make the best horse out of this? I think that is very human-centered, a very human-centered perspective, a very ego-centered perspective. I prefer the horse-centered, the equine-centered perspective, where I'm looking at a horse and think, okay, this is interesting that you are moving the way you're moving. What do you need this compensation for? Where are your chances and where are your limitations? Mm. And the beauty of that is this system we can not only use for general training planning, we can not only use that for detecting equine discomfort, we can also use that for opening up new movement areas. And if we are having a chronic patient, we can say, okay, this is off limits. Some horses are working perfectly fine on the ground, but can't be ridden anymore. Some horses can be ridden, but what would be a typical example? For example, if they are having a knee injury, a chronical, a very slight dysfunction in the knee, they are usually difficult to find if they are not jumping higher than 60 centimeters, or if they are only doing shoulder ins but not quarter ins. So the quarter in, let's say we have a knee injury on the right, then the quarter in on the right side is always difficult. The canter on the left is always difficult, but the rest the horse can perfectly fine do. So what do we do then? Do we focus on our training on what is difficult and what is taking money off the bank account? Or do we focus on our training on what is easy to do for the horse, where we can develop joy, joy of movement, life quality, and logical, right? I don't need to go into further detail. Even when I'm teaching, or especially when I'm teaching one-on-ones, I always have this perspective of functional gait analysis lying under. And I would like you to think from that perspective too. And if you would like to go home now and do a couple of small exercises, download our freebie. There you also have a €0 workbook that we have, where you can start training your eyes. As a first step, I would like to ask you to put small markers on the horse's body. For that, you can use chalk, make the chalk a little bit wet, mark the horse and let it dry. Then you will see perfectly fine. I'm often using the chalk that my daughter is playing with. Works perfectly fine. Very, very good enough. You can also use tape band if you have something that is yellow or red or whatever. Try to not use acrylic. That's a little bit ugly, but everything else is really ugly. And then we are marking bony landmarks. And bony landmarks are called bony landmarks because there are waypoints on the equine body. And these waypoints will help you, if you mark them, will help you to train your eye and to see if the movement is symmetrical or asymmetrical. And then you would like to see the horse from different perspectives. You want to see it straight away from the camera, turn around, walk straight towards the camera, turn around, walk back. You would like to see it from the lateral perspective, from right to left and left to right, that the horse is going back and forth. And we would like to see the horse on hard ground. That doesn't have to be asphalt, but of course, if we want to judge how is the hoof hitting the ground, and are the hoofs going up the same way on both sides, and so on and so on. It would help if you can see the hoof. So if the grass is 10 centimeters high, we can't see that anymore. Logical. If you have a very deep sand arena, we can't see that anymore. So we need to have comparably hard ground. What I would also like to see, also from a lateral perspective, is the figure 8. And we have also here in the download file, we have been putting in a few examples for you, what is easy to film, how you can film that without needing expensive gear or something. You just put a phone on a tripod and then film the different perspectives. Ideally, you have your horse marked. And ideally, if the horse is tolerating that, also put on his nostrils or in the middle of the skull somewhere, put a little marker. And there are so many things that if you want to do this professional, come to the masterclass. If you are just starting to do that at home, look at symmetry and asymmetry. And if we have a very asymmetrical movement, then we know something is really, really wrong. If you also see that when you're looking from behind, for example, one half of the butt is more muscled than the other half, something is really, really wrong. If I am looking at these recordings, I am looking not only at the symmetry of movement, I am also looking at things like how is the horse organizing when we do this figure 8, and how is it coming from left to right and back, for example. What I'm also looking at is the muscles. Do we have an atrophy somewhere? And what I'm also looking at, and that is what I would like you to put on your homework list, is how are the hooves hitting the ground? Because that is often the easiest thing for people to see. Do we have a heel footing, normal? Do we have a flat footing, abnormal but tolerable? Or do we have a toe footing, very abnormal? And do we have the same length of strides, or is one leg stronger than the other one? Very abnormal. We don't want to see that. And when we are looking at this nose, we would always like to see an endless loop, a figure 8. Same in between both front legs. And if we are seeing like the horse is leveling up here, like using head and neck like a leverage, we can also say very, very abnormal. Then you should ask a specialist to have another look at that. So go home, train your eye, see how is your horse moving without any load. That is important. Don't interfere with the horse, because this is not about you. It's about the pony. It's not about how good can you make it walk. It's about the horse. How good can the horse feel in its own body? And if you think you need help, if you find something that is interesting, or if you would like to have professional training advice, or you don't know what you should do with your findings, you are very welcome to book a Compass call with me or the Equidemia team. We are all in there in the Compass call. You can just see which time zone or time frame is fitting you best. And then we are mapping out a possible road for you and your horse together. Where are we starting? Where are we going to? And what are possibilities and limitations? And sometimes we get surprised, and sometimes it goes exactly as expected. But we are very happy to guide you on your journey. So I hope to see you soon in one of the Compass calls, or in a time slot for a gait analysis. And until then, I wish you a very good time with your horses. Talk soon.